Tamil Nadu reported the first COVID-19 case on March 7 and was announced on March 9. The state witnessed a spike in the cases from the end of March. Tamil Nadu has become one among the states with higher number of cases in the country. Almost all the districts in the state reported the cases. But Chennai, Coimbatore and Tirupur, which are the industrial belt with large migrant population, accounted for the high numbers. COVID-19 infection has been reported across the sectors from various places. On April 22nd, doctors at the Rajiv Gandhi Medical College, Chennai, protested and threatened to abstain from their work since many healthcare workers are being affected and adequate protective measures are not ensured. On April 19, a 55-year-old neurosurgeon died due to COVID-19 infection from his patient, and his burial in Chennai became an issue since the local residents had protested against it. The incident created panic and anger among the medical fraternity. The concerns from the healthcare sector that the workers in the sector, including doctors, don't have adequate personal protective equipment and safety measures was raised much earlier, but the government failed to address the demands. A few days ago, an image of doctors attending to patients in the COVID-19 isolation ward was shared in the social media widely. They were wearing aprons and masks used for surgical purposes and not the ones recommended for treating COVID-19 patients. Their necks and portions of faces were left uncovered, leaving them vulnerable to the attack. This was happening despite the tall claims of the government on the availability of sufficient N95 masks and PPEs. There was another picture in the social media showing the frontline sanitary workers being packed in a bus. They alleged that it was the negligence of the authority to make them work and travel like this. Journalists are the other section recently affected due to the negligence from the authorities. On April 21st, around 25 journalists from a local TV channel reported COVID-19 positive. Another 10 more positive cases were reported on 23rd April. Many journalists had to undergo the test and hundreds of people had to undergo isolation because of this issue. The government had appreciated the journalists for their contribution at this difficult time, but safety is not guaranteed. The Tamil Nadu government has committed mistakes in tackling the COVID-19 scenario from the beginning. That is the reason there was a sudden spike in the cases in the state. The state government has not taken adequate measures to confine the foreign travelers within isolation starting from their arrival. There was no proper identification at the initial time, no tracing of their local travel and publishing of their route map. No orders were given to the health workers or relevant forces of the state to isolate the patients or probable infected persons. Nothing like what Kerala has done. In Tamil Nadu, tens of primary contacts got infected from the patients or from their air travelers. This shows that the spread of the virus is mainly because of improper tackling of the COVID-19 scenario. The communal fanatics wanted to give a communal color to the sudden spike in the case state. Because of their own vested interest in it, they see religion in everything. They discriminate people based on religion and divide them according to their wish. The Tamil Nadu government should have acted carefully by understanding this hatred in the name of religion, but they failed to do so. Instead, they declared the daily reports by attributing the bulk cases in Tablighi event as Delhi conference and single source event at Delhi. Tamil Nadu is one of the states having the most reported cases. It shows that testing has to be still increased to identify the people affected and contain the virus spread. The World Health Organization has recommended increasing the number of tests. Tamil Nadu Health Minister earlier claimed that the state has a testing capacity of more than 6,000 per day, but the number of tests still remain too low given the impact of the pandemic across the state. The testing rate was very low in the initial stage, which became a factor to the spike of the cases in the state later on. The testing rate in the state is still low compared to other states of the country. The all-of-a-sudden lockdown announced by the Prime Minister Narendra Modi pushed many workers in the state into chaos, and the state was not prepared to handle the situation properly. Apart from the lockdown, the state government had not taken stringent measures initially to curb the mobility. Many places in the state witnessed a little vehicle flow many times. Tamil Nadu government has not taken enough steps like what Kerala government has done to tackle the scenario of the COVID-19 pandemic. If Tamil Nadu could have taken the measures effectively from the beginning itself, like what their Kerala counterparts has done, then the state wouldn't have landed up in this kind of a situation.